Hi, Dr. Fauci. How are you?
I'm fine, Maddison. Nice to see you.
Nice to see you too. Thank you so much for talking to me. This is such an honor. You have been such a voice of knowledge and reason and comfort throughout this whole pandemic. And I'm so excited to talk to you and ask you some questions about the vaccine. Is that okay?
That's fine. Thank you. Good to be with you.
Thank you. Well, my first question is, why do you think it's so important for young people specifically to get vaccinated?
Well, there are several reasons. One, for their own personal safety. I mean, there's this myth that young people never, ever get a serious outcome. And that's just not the case. Certainly, it is less likely for a younger person to get seriously ill compared to an elderly person or someone who has an underlying condition.
Sure.
But young people can get seriously ill and can die from COVID-19. In fact, if you look at the pediatric hospitals, Maddison, right now, today, in the surge we're going through, the beds are being overrun with children who've been infected and who are seriously ill. So the myth about young people not ever getting seriously ill is just not true. Secondly, it's important as part of the overall societal effort to end the outbreak, because young people can get infected. And even if they get no symptoms or minimal symptoms, they can then, in many respects, inadvertently and innocently pass the infection on to someone else who might actually be very vulnerable. That could be an elderly person or a person who has immunosuppression or immunodeficient, who would actually have a greater chance of getting a serious outcome. So I divide it into two buckets. One is personal responsibility for yourself, but also societal responsibility for being part of the solution to the outbreak instead of propagating and perpetuating the problem.
Exactly. You have to do it for yourself and for others, which kind of leads me to my next question. What can we do to reassure people who are hesitant to get the vaccine to do so and encourage them to realize that it's safe?
Well, first of all, you don't want to be accusatory towards them, because people who are hesitant, if you sort of point your finger at them, they will withdraw even more. So my suggestion, and what's worked, is to try and understand what it is that they are hesitant about. Do they think that the vaccine was developed too quickly? You know, you could respond to that by saying, actually, the science, the basic and clinical research that went into the successful development of the vaccine was research that was going on for a couple of decades before SARS-CoV-2 came along. So it isn't as if it was done overnight. Right. The next people say, well, you know, I'm not sure that it actually has been given to enough people. Well, wrong. It's been given to hundreds of millions of people so far, and it proves to be highly effective and very safe. So I would just march through the potential reasons why they're hesitant and try and answer each and every one of them. And maybe at the end of the discussion, you will have convinced somebody to get vaccinated. And you might, in fact, be saving them from suffering and maybe even saving their lives.
It's a great strategy. I really like what you said about not attacking people who believe that. I think that's really smart. How did the Delta variant arise, and how does being vaccinated help prevent further mutations? It's a question my friends and I have talked about a lot.
Yeah. Well, the Delta variant arose because of mutations. So when you have, viruses naturally tend to mutate. The more they circulate, the more they mutate. There's a tenet in virology, Maddison, that says a virus will not mutate if you don't allow it to replicate. And since there's so much replication going on with spread, every once in a while, it's going to mutate and mutate and mutate. And then sooner or later, it mutates enough in the right spot to make it a variant. And a variant means it changes a bit the function of whether a vaccine will work or a monoclonal antibody will work. So it was understandable how the Delta variant arose. It just had a lot of circulating virus around it, which gets to the second part of your question. The best way to prevent future variants is to get as many people vaccinated as quickly as you possibly can, because when you shut down the opportunity of the virus to replicate, you will shut down its ability to mutate. Remember, no replication, no mutation. So if you do that, you'll stop it from mutating.
No replication, no mutation. I hear women talk about a lot that they hear that vaccine causes infertility issues. Could you explain why that's not true?
Well, it's not true because it's a fact. I mean, if you look at the tens and tens and tens of thousands of women who are vaccinated and got pregnant, that just speaks for itself. And then also, there's no mechanistic reason to imagine that it would have anything to do with fertility. I mean, there's no mechanism, and mRNA has nothing to do with germ cells and fertility. So not only does it not happen, there's no reason to even suspect that it would happen.
It's great to hear. And my last question, in the future, do you think it's going to be safe for children to get vaccinated? And why is it important for kids to get vaccinated?
Oh, I'm certain that it's going to be safe for children to get vaccinated. We're doing the studies right now. We know from 12 and older, it already shown to be safe and effective. We're working on studies now to see if from 11 and younger down to 6 months of age, if it's safe and it induces the proper immune response. Thus far, the data look very favorable. So I would be very surprised if we don't have vaccinations for young children very soon.
Okay, great. I want my niece and nephews to get vaccinated, so that's very good for me to hear.
Terrific.
Thank you so much, Dr. Fauci. This was so helpful, and I'm really excited to pass all this along to my followers. Thank you for taking the time.
My pleasure. Good to be with you, Maddison.
Nice to meet you. Thank you.
Bye-bye.